o'clock. Got Veronica here. I've got Mike Sigler here.
Yay! Well, thank you.
No Randy yet. And Travis was a maybe, so. Travis is a no? Okay, okay, thank you. All right, well, let's just wait 30 seconds more, see if Randy wanders in. Said Veronica wandered out. We don't have a quorum, so, okay.
Quorum denied.
Anybody know any Health and Human Services jokes? No? Next time I'm coming with some. Okay, let's get started. Welcome everyone to the Monday, November 21st, 2022 Health and Human Services Committee meeting. There is one change to the agenda, or is there something added? Two changes. Help me out here.
So it's the Office for the Aging resolution, and then also the housing presentation. Both are on your desk.
Okay. Right. The Office of the Aging is a budget adjustment. Okay. And the other one's just the presentation. Okay. Very good. Thank you. Anything else anyone knows of? Okay. Is there any public comment today? Did we hear from anybody? No? All right. And there's nobody on screen that wants to talk. I've already spoken with a person in the chambers. They do not want to speak tonight. Okay, very good. On to the chair's report. I only have one small thing to report is that last month, I think it was in this committee, I don't think, because the same thing went to both government operations and here, when we looked at amending the charter to accommodate the merger of the Public Health Department and the Mental Health Department, we saw this language that was in the New York State mental hygiene law that several members found kind of offensive, old-fashioned, and so we said we would look into what might be involved in changing that in the state level. So I did send off an email to Anna Kellis's office, our state assembly person, and haven't heard back yet, but when I do, I'll report on that to see if she has any guidance for us about what we might do, what the process might be to request a review of that language and see if it might be changed. So that's my whole chair's report. We are up to the county administrator's report. Hello, Lisa, do you have anything for us today?
Sorry about that. Yes, a couple of brief items. I just wanted to make the committee aware. The Homeless Services Coordinator one-time couple-year position that was in the county budget for 2023 that will go in county administration. We've been updating the job description, and many thanks to our partners at the HSC and Continuum of Care for helping us to take a look at that job description and hone it a bit more, and plan to post that with the intent to hire as soon in 2023 as possible. So, so that's one item. Secondly, and I think the committee is aware, but this impacts many of the staff in departments that report to this committee, is the healthcare worker bonus program. Bridget Nugent has done a lot of work coordinating together with the HR and payroll, finance, and the affected departments on titles that are potentially eligible, and has gotten that documentation in to draw down the state funds for the healthcare worker bonus program. there was one other item that I wanted to mention, and the final item is I connected with NISAC, and they are still very much working on the Medicaid EF-MAP reconciliations for counties. So that's some funds that are due counties from New York State for Medicaid reimbursement, federal Medicaid reimbursement, and so that is still on NISAC's radar, just to let folks know that we're still looking for that. And I think that's all I have.
Thank you. Questions or comments for Lisa? Lisa, I wanted to ask you the updated job description for the Homeless Services Coordinator. Could we send that around?
Sure.
Excuse me. Thank you. And did you suggest that it was going to be posted before January 1st?
Yeah, so we could hopefully hit the ground running after the holidays with interviews.
Excellent. Thank you.
Mm-hmm.
Anything else? All right. Thank you. Well, we are right up to our first presentation of today. We have two presentations. The first one is on housing from Tompkins County Department of Planning and Sustainability, Housing Program Overview and Recommendations. Okay, housing people, you're on. Introduce yourselves and jump right in.
Well, Elliot's getting set up. I'm Megan McDonald, Deputy Commissioner of Planning and Sustainability, and I'm delighted to be here today with Elliot Benman, our new Housing and Community Development Planner, who's going to be delivering the presentation. There's also a packet that gives a little bit more detail in your packets about some of the programs that have been ongoing through the Department of Planning and Sustainability for a long time. And we should note, this is from that lens. We recognize that there are a lot of other ways the county as an organization touches housing through other departments as well. So we'll focus on our department's activities today.
Good afternoon. I'm Elliot Benman, Housing and Community Development Planner with the Department of Planning and Sustainability. And I'm just going to jump right into our presentation. So we have a short presentation on the department's housing activities, as well as some information about new directions for the department's housing activities in the coming year. First up, just a review of our current activities. So first, the Community Housing Development Fund, or CHDF, which is a partnership between Tompkins County, Cornell University, and the city of Ithaca to support the development of affordable housing, generally geared toward households with incomes at or below 80% of area median income. To date, the CHDF has awarded almost $6 million to affordable housing developers for 810 affordable housing units. Typically, the CHDF awards are a small part of the overall project budget for a given project. However, the real importance is that once developers have this award in place, they're well positioned to leverage other funding sources. So since 2009, the approximately $6 million in CHDF awards have been used to leverage over $244 million in private, state, and federal investments. Next is the Community Development Block Grant Program, which is an external state funding source through the Home and Community Renewal. This can be used for home rehab, home ownership assistance programs, and for water and septic. So as a non-entitlement community, Tompkins County has to compete with other jurisdictions to win this funding. To date, through the Department of Planning and Sustainability, Tompkins County has received $3.6 million in CDBG funds. And I should also mention that INHS is our subrecipient for these funds, and they actually administer the programs. Next, we have the Housing Affordability and Supportive Infrastructure Grant Program, which started more recently in 2019. So this program is for municipalities to support their housing affordability efforts. So far, we've assisted 4 municipalities, including assisting 2 municipalities successfully write grants, which brought in a total of $1 million in CDBG rehab funds. The department also, on a roughly biannual basis, issues a housing snapshot report. So I wanted to present just a little bit of information from the most recent report in 2020, just to show you what the challenge is, despite the progress that we made or the positive impact that our programs have had. So first, the 2016 Housing Needs Assessment set targets for housing production for different housing types and different price points. So here we're looking at ownership housing at different price points. The goal is indicated by the blue line, and what the market has actually produced is shown in the bars year by year. So as you can see, there's a gap between what we were aiming for and what the market has been producing. And the undersupply of ownership housing, of course, puts more pressure on the rental market. And similarly, if you look at the report, you'll see that rental housing production has also fallen short of our targets. So the implication of that is what you see here in terms of housing cost burden. So looking at rental housing cost burden, so you can see that over half of renter households are housing cost burdened, meaning they spend more than 30% of their income on housing, and over a third are severely burdened, meaning they spend more than half of their income on housing. And that severely burdened figure increased significantly from 2010 to 2020. And of course, in more recent years, we've seen escalating home prices, rents, and construction costs. And finally, I wanted to share with you, so in addition to the activities we're currently undertaking, some ideas we have for new directions for housing activities that we expect DPS staff to allocate time to in the coming year. So first of all, the first one is support manufactured home replacement, as well as preserve affordability of manufactured home parks. So this is coming from a lot of conversations that we've been having with our local partners, and increasing awareness of the importance of this housing stock as sort of natural, affordable housing. And as well as the threat posed by the purchase of manufactured home parks by on-estate investors and investment funds. So in terms of what Department of Planning and Sustainability can do, it might consist of collecting and sharing data, identifying funding sources, and pushing out information about funding sources, incorporating manufactured homes more explicitly into our existing housing funding programs, as well as being ready to support any efforts in regards to nonprofit purchase of manufactured home parks or conversion to resident-owned communities. Second is to launch a new outreach effort, housing outreach effort, but this time to focus on identifying specific development sites and opportunities for public-private partnerships. So this might consist of publicly owned properties, including properties owned by the county, potentially, privately owned properties that represent major redevelopment opportunities, as well as outreach to major employers who might be interested in developing workforce housing. And then finally, we want to focus on bringing in funding to the county for permanently affordable housing production. So the big funding source that we've been bringing in, as I spoke to earlier, is the Community Development Block Grant Program, which focuses on rehab, home ownership assistance for existing units. So the starting point here would be to have discussions with our state partners to explore the possibilities of using CDBG funding in new ways in addressing some of the restrictions that make the program not optimally aligned to the county's housing priorities. So I touched briefly on those 3 points, and if any of you have any questions or would like to discuss further, we're happy to do so.
That's Mike?
I just had 2 questions. You gave grants to Dryden and Danby. I was wondering, how is that money tracked? Like, do they give a report, like a quarterly report, something like that?
Speak to this one. It's actually provided on a reimbursement basis. So once they've actually, contracted and, for an example, had a consultant write a grant application for them, at that point they can submit those materials to the county for payment. We don't, that program's not predicated on success, although we like to see it, and it's great that we are seeing it. So we keep in touch with the municipalities to find out what happens to those grant applications once award announcements are made so that we can track the success of the program.
Cool. Do we know any of that yet, or is that too early?
It's early stages, so we know these 2 awards have been made. So those would be, I can say from our experience, CDBG programs take a little while to get set up. So to be able to, I think in future years, we'll be able to tell you exactly how many homes they were able to rehab or, those sorts of things too. So you can kind of see the next step down the road that you supported through the legislature's funding of this program, the actual application development, and then so now we know the award amount given, and then we'll be able to say how many actual homeowners were assisted through that program.
Cool. My other question was a graph you put up. It was about built homes, where the goal was, and then the built homes was much lower. Was that, is that all new lumber, or is that houses we've taken over and rehabbed included in that, or is it?
Sorry, so yeah, those bars with the numbers above them represent the housing units built. So we, another thing that the department does is track development activity over time. So from assessment, we get data on housing units that have been completed. So in this case, ownership housing units.
So if it's an existing house and rehab it and make it into a housing unit, that would be included in that, or that would not?
If it was a rehabbed house, yeah, I believe if it changed use from something else, from a different use, most likely.
But I would say with the caveat that if, like a single family home has been rented out and now has been, sold again, and now it's owner occupied, that's a lot harder to capture through the assessment data. So single family homes, I think, and even duplexes can be particularly challenging in terms of data compared to, multifamily projects that we tend to know about.
Gotcha. Thanks.
Randy.
Yes, thank you. I actually had a question on that same point that Mike had. Does that include manufactured homes or just actually constructed homes?
Good question. I can't answer with any certainty.
Yeah, I would say it does. I don't believe it captures owner-occupied manufactured homes in mobile home parks or manufactured home parks because the land isn't fee simple owned, but it would capture owner-occupied on owned land, those manufactured homes. Yeah.
That means it's even worse. What do you think the major issue is why people aren't able to get home ownership under $200,000?
I will say a large one is, I've been with the county for about 9 years now, and I think when I first started, we were hearing from both for-profit and nonprofit developers that it was difficult to build a unit for under $300,000. Very quickly, that became $350,000. Now we're seeing, even mission-driven organizations, in some cases, costing, upwards of $400,000 plus per unit. And so if you can't actually build the unit for what the household can afford to pay for it, even if you're mission-driven and seeking other subsidies and things, it's particularly challenging to build at scale. So that's why even through the Community Housing Development Fund, although we are supporting owner-occupied housing through that program, it tends to be a much slower pace and require a lot more kind of funds, per unit from the program.
One of the issues, I was speaking to a person who sells manufactured homes, is for people to get the land to put that on. So it's a search quite often for them to find 2 acres or 3 acres of land. And it takes some people years to find someone who will sell them land to do that. So I think land access seems to be an issue as well.
Veronica.
Thank you. Maybe kind of continuing the same line of questioning. So when we look at this graph, what kinds of units should we be envisioning? Like, these are housing units that were built to be owned by whoever's living in them, and are these mostly freestanding single houses as opposed to duplexes or condos or units in a larger building?
I believe it's a mix. So I think where you're seeing on the left side, the more affordable homes, many of those are through entities like the Community Housing Trust that INHS operates, also Habitat for Humanity. So in some cases, some of those homes are duplexes and are still able to be owned because of the way they have the land ownership underneath them. I know in previous years when the legislature had its Housing and Economic Development Committee, a Cornell student did some research onto the condo side, because I know that that was a hope for, kind of more affordable home ownership options. But that report describes a lot of the challenges there for kind of having a little bit more of a multifamily home ownership option.
Where can I find that report? Because I was going to ask, why can't we have, say, 4 purchase apartments in a building?
It would be in the legislature's records, but I'm happy to just share a link, and I can make sure it goes out so it's a little easier to find in the records. Yeah.
That'd be awesome, thanks. And it sounds like other folks know, but I don't. For a lot of the manufactured homes in the county, whether in parks or not, what is the usual ownership structure for that? Or who own, or if the people living there don't own the land, who does or what does?
Typically, there's one owner of the parcel, the entire parcel that makes up the park, and the lots within that park are rented out to the residents living there. The residents might also rent the home that's on that lot, or they might own that home, even though they don't own the land underneath. And that presents some challenges to manufactured home replacement funding programs, because they'll often require that the land also be owned by the resident.
Okay, thank you. And when you mentioned the threat of purchase of these places by out-of-state investors, what does that look like?
Yeah, so that's something that's come up over and over again in discussions I've been having with our various partners in Tompkins County. Typically, when these parks are purchased as an investment, and they're looking to maximize profit, and that often leads to rents being increased, which potentially to evictions, and there are also a lot of complaints about just the conditions within the park once they're bought out, And we have heard, I was in a meeting with a Dryden working group, and we spoke with an owner of a park in Tompkins County, and he says several times a week he receives offers from out-of-state investors for his park. So I don't know, to what degree this is already affecting Tompkins County and the parks here, what's been purchased, but definitely it's something happening nationwide and something we should be, keeping an eye on.
Randy.
Thank you. I'm on the same committee with Elliot, and one of the concerns about investment groups buying these mobile home parks is that the situation will just continue, where sometimes they're not well kept. There's no services there. There's very few have any kind of public space or a place for kids to play or anything. So there's no real restrictions other than collecting their rent, which quite often they will increase. And it can be $400 and up per month just for renting a spot in a park. In the analysis, we looked at the data. I would say over half of the people actually own their manufactured homes, either on private lots or in the parks themselves. So that was interesting. But I have a question on Ithaca neighborhood housing. So you mentioned they're the only entity that you're doing the one, is it the block fund?
Community Development Block Group, Block Grant Program, yeah.
Do they ever provide reports to the county on what they're doing and activities and success rates? And the reason I ask is because they manage a place in Newfield, and although they do not have ownership of it, the USDA does somehow. It's like having an absentee landlord, basically, with the USDA. The Ithaca neighborhood housing is providing services, but at a very limited amount because of funding from the USDA. And at least that's how it was explained to me from Ithaca neighborhood housing. So I'm just curious how all the locations that they are managing or own, if they have to report in any way, or maybe they don't. So.
I think in terms of through our department, we probably most closely work with them on these CDBG activities because they're actually a subrecipient to the county for the grant award. In terms of kind of their general activities, I know they produce their annual reports and have their annual meetings, which just this year came back in person. But I think they've generally as an organization been very responsive. So if like if this group was seeking particular information or wanted them to speak to a particular issue at your meeting or such, I think they'd be happy to take any particular request. So if there is something, or if just there's a certain piece of information you're seeking about certain properties.
I reached out and I am in contact directly with them, but I just wanted to see if that was something they regularly did. So, okay.
The CDBG program does have very extensive reporting requirements to the state. So when rounds are wrapping up, Megan could speak to this more than me, but when rounds are wrapping up, there's extensive reporting that's done, number of houses rehabbed and so forth.
I wanted to ask, the housing program, it's sustainable housing, or I can't remember the title of the fund, the one that Danby got earlier this year. So that will be renewed, that's like an annual process. And do the rules sometimes change about that? I noticed that the rules said it was for this year. I'm just wondering if that's like an ongoing.
Yeah, so the program, so that was, and I think the name has morphed a little bit since it started in 2019. So yes, now I think we're saying the acronym may not roll off the tongue, but HASIG, I suppose you could call it, the Housing Affordability and Supportive Infrastructure Grant. It's been fairly consistent. I'll say part of the name change had to do with, I think when the program was first envisioned, the focus was housing affordability, but it quickly became apparent that infrastructure is inherently tied to the affordability of housing and is an important need. So that's where the title sort of expanded to make it very clear to the municipalities. So I don't believe the maximum grant awards have really increased over the years. This was intended as a pilot, and you did approve an OTR in the 2023 budget because we recognize it really, it started right before the pandemic, and so the last couple of years haven't been very typical for any of us, particularly municipalities that were juggling a lot of priorities. So I think with a little bit more time in the program, you'll have a little bit more data as well to evaluate how permanent a program you'd like that to be.
And it has been included in the 2023 budget.
Okay. And when will it roll out again next year? Sometime
We anticipate that the conversation, so I will be overseeing this program starting next year, and in discussions we have, it seems like maybe the February, March timeframe would be the rollout.
Thank you. Any other questions? Thank you so much. That was a lot of information. County's doing a lot of good stuff, and there's a lot more resources out there if people want to dig deeper. All right. In just a minute, we're going to move into our next presentation. The next presentation is from the Human Services Coalition and the Continuum of Care, and it's called Home Together Tompkins. So if everybody that is here from the Human Services Coalition would introduce yourselves, and then when you're ready, just dive right in.
Go ahead, Cindy. Hi, I'm Cindy Wilcox. I'm the Executive Director of the Human Services Coalition. Cindy? My name is Liddy Barger. I use she, her pronouns. I'm the Director of Housing Initiatives here at the Human Services Coalition.
Hi, my name is Simone Gatson. I use they, them pronoun. I am COC staff as well as coordinated entry lead for our COC programming, and I work for the Human Services Coalition.
Thank you. Go ahead and jump right in.
All right. Are we able to share screen? Yeah. All right. There we go. Great. Hello. So I am Liddy Barger, Director of Housing Initiatives, and we are here today to talk with you about Home Together Tompkins, which is the Continuum of Care's proposed plan to end unsheltered homelessness here in our community. Next slide. So this is just some background for you about the sort of origins of this plan. We are coming from, in 2021, the county, the city, and the Continuum of Care commissioned a really deep dive into our data and did some qualitative interviews and focus groups and produced a really stellar homeless and housing needs assessment. And the Continuum of Care kind of made it our business to really dive into that report. We formed our committees around the recommendations of that report and have done action planning within the committees, which really formed the pillars of this plan. We also did use the Home Together UCICH plan as some of our backbone. The United States Interagency Council on Homelessness is the federal group tasked with setting policy around homelessness at the federal level. They have 19 federal partner agencies, and this plan is fully aligned with the UCICH federal strategic plan to end homelessness. We also really centered our plan around a public health model and the belief that housing is as sort of a public health intervention. We do consider the growth of people experiencing unsheltered homelessness to be at a crisis, and we consider that to be a public health crisis as opposed to any other kind of crisis, and identify that we assert that the way to solve the unsheltered homelessness crisis is not to just move sort of people around from one unsheltered location to another, but to really dive in as a community to figure out how to serve people experiencing unsheltered homelessness with permanent housing or more appropriate indoor accommodations. Next slide, please. These are some definitions. So I think, well, we know that we gave this group a presentation from the Lisa Horn report. So some of you have had at least a foundation of it. In May, we shared this information. Generally, when we are talking about continuum of care activities, we're talking about people who are meeting that literal definition of homelessness, which is sleeping in a place not meant for human habitation or in a publicly funded emergency shelter. For this plan, we have expanded that definition to include people with severe service needs. So HUD earlier this year came out with a new funding source, and they introduced this concept of severe service needs to be more inclusive of people in our system. So HUD defines people as having severe service needs as people who have a combination of any of the factors listed on the slide. They are things like being in an unsheltered location, a heavy utilization of emergency rooms, jails, other institutions, people who are vulnerable to death or illness, high vulnerability to victimization. I think we all are getting the sense of what severe service needs are. And then we also wanted to make really clear that this entire plan is rooted in housing first. So we want to define housing first for you right here. Housing first is an evidence-based approach, has a long history of data and evidence to support it, that prioritizes and believes that all persons are housing ready, and that housing ends homelessness and is really the first step to being able to make any other meaningful changes in people's lives. So believes that to end the person's homelessness, you basically prescribe housing, and then you wrap services around that person, allow them to build trust in systems, grow their relationships, and be ready, willing, and able to address whatever their other service needs might be. That is housing first. Next slide, please. What's the plan? Here it is. This is the plan. So it's a community-wide plan. We are looking for buy-in community-wide from cross-sector providers, people in all kinds of businesses and sectors doing all kinds of different things, working together in alignment on the following strategies. So none of these are going to be like totally mind-blowing, but we need to increase our stock of permanent supportive housing. This is supported all over the place, including in the Tompkins County Planning Department's 2020 Housing Snapshot, provided a lot of data around this need, and lots of other data. So we want to increase our stock of permanent supportive housing. We want to expand our emergency shelter capacity by expanding the kinds of emergency shelter that is available in our community. We want to organize and implement a housing surge, which is another evidence-based practice that we can get into a little bit later in the presentation. We want to address some of those staff shortages that are kind of crippling our agencies right now. We have an idea for all of you. And then we also would like to meaningfully improve people's access to resources. Next slide, please. What do we hope to achieve? Later today, you're going to see another image that has like outcomes and metrics and numbers and timelines and stuff. But this is the basic stuff we want to achieve. So this is a plan that addresses homelessness specifically and primarily. So our number one hope is to reduce the number of people experiencing unsheltered homelessness, reduce the number of people experiencing chronic homelessness in our system. That's it. That's our number one goal. We think that by doing that and aligning with our plan, we will see improved health outcomes from people across our system. So the evidence suggests that access to safe housing and access to preventative physical and mental health care does lead to less interactions with those first responders, less emergency room visits, less institutions, all of those things, which does improve the health of our entire community. We also have a real hope of improving relationships in our community. So we want to engage business owners, landlords, neighbors, and leverage those partnerships, strengthen those relationships, and really have a truly thriving community for all of our members. Next slide, please. So low barrier shelter is sort of a spicy topic for people. We wanted to share this slide. This is all sourced from leading practices and evidence that we've seen across the country about how low barrier shelter can work and why it works. So we wanted to share some of these with you. I believe these are actually all sourced from that UCICH group, so a federal group. These are the reasons for low barrier shelter, or why it works. So easy access. So when people can access shelter as needed without being screened out. Basically, the model is to screen people in instead of screening them out. They are more likely to come indoors. When we shift from a higher barrier shelter to a lower barrier shelter, the rules become expectations, and the focus becomes truly on safety of the individual who's in shelter, safety of their peers who are in the shelter space with them, and on staff, instead of having a focus on compliance in any way. What we know about compliance-based rules in shelter is that they sort of distract from the work of finding housing or being housing focused, and sort of can act as a place that people get caught up where it might not be necessary, right? So we ask people to take a look at what those rules are and how important are they. Low barrier shelter operates from a trauma-informed operating culture. So people experiencing homelessness, I imagine this will not be a big surprise to anyone, have really high levels of trauma, crisis, high levels of stress. It affects their health. It affects the way that they're making decisions. So really making sure that any staff that are interacting with people who are in the shelter space have real trauma-informed training is essential to building that trust and building those relationships so people can, again, get down to the work of moving into their permanent housing destination. We do recommend relaxed sobriety and curfew measures. This is another one of those places where people, when they can rethink like the why of their rules and take a look at the data from places that have rethought those, what we are seeing is that people have better outcomes with those more relaxed sobriety and curfew measures. And that again has to do with those relationships and trust and truly meeting people where they are as part of their journey into permanent housing. We have more to say about it later, I think, actually, some of this stuff. Next slide, please. These are some of the barriers that were identified by the committees of the continuum of care in our action planning process. A lot of these are known barriers to people. We don't need to spend a lot of time on this slide, but these are the known barriers in our system as reported from providers and recipients of services in our system. We can come back if people have questions. And I am going to turn it over to Simone, who's going to take it from here.
Great. Hi, everyone. So this is quite a slide. I'm going to break it down for you. So this is essentially our plan. There's three big categories of interventions here. The first is expanding access to housing that is set aside for this population. So that would include a commitment to building 100 studio and one-bedroom units of permanent supportive housing. What the data shows is that single adults actually have the worst outcomes in our continuum. So this will kind of be an intervention to really address the accessibility of the housing that's available to this population. And also permanent supportive housing is another evidence-based intervention that really does work in our community and was the findings of the Lisa Horn needs assessment. So we really look at this as our main one of the main aspects of this plan is really expanding the housing that is available for this population. The second is also building a low barrier shelter so that like Lydia was talking about, removes a lot of these preconditions to entering shelter and uses a trauma-informed approach to safety. So really this focus on making sure that people are safe in this space and having those clear expectations and a focus on working towards a permanent housing destination rather than just staying in compliance to stay in the shelter. The third is using this housing surge strategy to quickly move people into housing or shelter. We'll get into a little bit more about how that works in another slide. But essentially, that's one of our short-term interventions, one of the ones that we can get started, 3 months from now in terms of just getting partners together and really quickly moving people, especially people who are in unsheltered locations who are interested in housing, into the housing and shelter that they want. The next big section is on incentive programs. So these are all really focused around engaging community members at all levels, engaging business owners, engaging landlords, engaging anyone else in this community who's interested in really investing in this issue and engaging with us. So the first is this idea of a mitigation fund for business owners and landlords who are serving people with severe service needs. Essentially, the idea around a mitigation fund is that it is this little pool of money that's available. In this case, that could be for any damages or theft that business owners or landlords incur while serving anyone, but especially serving people with severe service needs. So we would have those funds available, but also what we call a neighborhood liaison, which would really help to facilitate communication from landlords and business owners to us, to the county, to the city, about the issues that they are finding, especially those that are, more central or close to the current encampment space. So really increasing the communication, but also understanding the hardship that a lot of business owners, landlords have been through, especially through the pandemic, and trying to ease that with a bit of funding to help alleviate some of that stress. Some other things, so other incentives for community members, so a shopping cart exchange, the idea of having kind of these collapsible, easy to repair carts to basically hand off with people who have shopping carts from local businesses and return those other carts to those businesses, as well as this cash for trash idea, which is essentially the idea of recycling redemption, but for trash pickup. So we'd have a bunch of, say, bright green trash bags and say, if you fill this up and bring it back, you can have $20 to go spend on dinner. So that's kind of the bird's eye lens idea of those. We can get into more details if people have questions, but those are a couple of the incentives. And the last one under this incentive programs bubble is easy access move-in packages and assistance for people moving from homeless to housed. So one of the findings of our sustainability committee or our housing stability committee, which is really looking at how do we help people stay in their housing once they've gotten into it, was that a lot of people, even if they're moving into a furnished apartment, may lack other things like cleaning supplies, kitchen utensils, trash tags. So really helping people with a flexible fund to be able to have those things that they need to maintain their housing on when they enter it. And then some other assistance, so helping with moving trucks or having actual people there to help them move their things in storage units. And then the last section is expanding sector capacity. So this would really be introducing 3 enhanced centralized housing navigator positions to supplement the existing outreach. We don't have any outreach positions currently that really focus solely on housing. A lot of it is relationship building and linkages to services, but there really is a need for a centralized team of housing navigators that can help to connect people to housing and have a specific, explicit focus on housing.
Hey, I just wanted to do, excuse me a second, I just want to do a quick time check. You're 20 minutes in, you had agreed to a 15-minute presentation, so I know you have a lot more to go, so if you could maybe accelerate the pace a little bit. Thank you.
Sure. So the next 2 paid board positions for people with lived experience to include their voices in this plan, and then finally professional development opportunities for people with lived experience. This is the housing surge process. Essentially, it's this idea of convening a lot of partners, creating a pool of housing units, and expediting the rehousing process and making it really easy for people to enter those units. They do this in cases of natural disasters, essentially, to help relocate people as soon as possible. So applying this especially to our unsheltered population that is interested in housing. This is the schedule. This is the big kind of what we would see as the rollout. So as you could see, the housing surges would start pretty soon, and everything else mostly would end up starting in Q1 of 2024 if we were able to get the funding and planning in line. There are some other complementary interventions. We're not saying that we have solved everything. This is a really complex issue, but we do think that there are some other specific interventions that might gel really well with the plan that we've created. There's a little section here about should we ban camping. We believe that camping bans essentially will erode trust and move people around in a way that doesn't necessarily fit in well with this plan because it is focused on making swift exits to housing. We can talk some more about this, but ultimately at the end of the day, we would recommend the use of inclusive public space management, which is essentially allowing people to meet their basic needs with dignity, again, using that public health lens, without necessarily using restrictive management practices such as camping bans, such as move-along orders, such as restrictive furniture, things like that. So again, providing access to trash disposal, safe needle disposal, drinking water, bathrooms and showers would be a huge improvement to the current conditions. We also have a couple of handouts essentially that will pass along that kind of summarize the data findings of the needs assessment as well as the outcomes of Home Together Tompkins, applying some real numbers to this. I'm just going to read the headings here really quick. So essentially, we believe that with this plan, we can reduce unsheltered homelessness by 70%. We can reduce returns to homelessness by 50%. That we can decrease homeless entries from couch surfing situations by 50% by introducing some of these preventative resources that I wasn't able to get as much into today, but that's okay. I'm open to questions. Decreasing the average length of time homeless by 30 days. We know there's a huge bottleneck in our system, so introducing that permanent supportive housing to resolve that bottleneck. Increased community engagement and increased accountability to business owners, landlords, and neighbors. We also want to center on a racial equity lens. So you might be able to see it, but in the data findings, we do see that about 50% of our sheltered population is BIPOC, which is disproportionate to the representation in our population. So making sure that we are meeting that goal of serving 50% BIPOC proportionate to their representation in our homeless response system. Thank you.
Okay, thank you. Questions, comments from the committee? Mike Sigler.
I have 2 comments and then a question. Going back to barriers, I could just tell you as a landlord, something that I noticed. I mean, I had a place up for rent recently, and I had several people calling saying, oh, do you take Section 8? Which, yes, of course, because, I mean, I always did anyway, but yeah, I mean, it's the law now. So the problem that we ran into was they were like, well, listen, that's great that you take Section 8. I'm going to have somebody call you from Section 8. And then nobody would ever call. And it was like, so I don't know if those people were like testing the system, which would be a bad thing if they did that because it gets rather frustrating talking to people after people that say, oh, no, we're interested, and then they kind of disappear. So if there are people out in the world trying to test the system, that's probably not great. But in this instance, it seemed like there were some people that had a voucher and just nobody would ever kind of follow up on it. I'm like, if you want the apartment, then just have somebody from Section 8 call me. I don't, because a lot of landlords, frankly, don't know the process. I don't know. I know you've got to come and you've got to inspect the property and make sure it's good for Section 8, but somebody has to take that step with the landlord. And I mean, the landlord, they don't even know who to reach out to. So that was just something on your barriers thing that I noticed. So I don't know what the situation is there. The other thing that you were talking about, I always thought a shower unit would be good just to kind of drag around town and offer people hot showers and a place to do their laundry. I saw something like that down in Philadelphia that I thought was kind of interesting. I mean, it was like 6 shower units. You go in, you can take a hot shower and be done because everybody feels better after a hot shower. My question here is your group heading this up? I used to call this the Slaughter Group, but now we'll call it the Wilcox Group. Are you guys heading this up, or is this going to be run at like DSS? I guess that's my big question. Because I have one landlord, he's got 18 units downtown that rent for about $400 a month, and he's kind of dealing with KIT, but if you want me to shove them over your way, I can do it that way too. It's fine. That was my big question. Sorry.
Were those questions? Okay.
But they don't have the answer to that. I don't know.
Yeah, I mean, that was all good feedback. I think that right now where we're at is we're looking for buy-in. We're not looking to take over any processes that are already being managed by DSS. Like, that whole process is working. We're not necessarily looking to like control the process, but if that landlord has suitable units to be included in a housing surge and interest in participating in something like a housing surge, that's the time at which, if we adopt this plan, that's the time at which we would be reaching out for landlords and saying, what do you got, my friends, and how can we get tenants into those places and make this as smooth and painless for you as a landlord and for this tenant to move into the units. So I don't know if that answers your question completely, but we are looking to align our community around some of the pillars of the plan and then work together to figure out the details.
Okay.
Although we'd be happy to figure out details for you if you'd like some help.
That's fine.
We love details.
So that's fine. Okay.
Other questions or comments? Veronica?
Yeah, thank you. This is really awesome. Thank you so much for presenting it. It's, I don't know, I haven't seen before such a comprehensive plan with like national recommendations and the local study and your own personal experience and things. I know we're short on time, so I will save other things I really like about it. But a question that always comes up here is like, if the county is going to buy in and be like, yeah, this is great, let's do it. Like, is there a more concrete ask? I realize you just said we'd work out the details later, but like, what are you envisioning, or what would we need to like discuss and communicate in order to be like, yeah, we're in?
I saw you come off mute, Cindy.
Go ahead, Letty, you can take it.
So we talked in the beginning of the meeting about the county homeless coordinator position that's coming online. What great timing, right? And so I think some of the work that there is to be done at a county level is to, I think there's some work to be done around cost analysis of the status quo versus another project, you know, a different style of project. I think there's work to be done around feasibility. And there's also a lot of work around aligning the county departments in sort of philosophy and approach to the issue of people experiencing homelessness. So I think that's like the first ask, right? Is like, let's all get on the same page and point it in the same direction. But I did see Lisa come on to the camera, so I'm wondering if you have thoughts here as well.
Well, I don't want to steal your thunder at all, Liddy. Those were the words that I was going to say as well, that I think with the advent of the homeless services coordinator, that role can really help to harness the activities across multiple departments, multiple county departments, and ensure that we are working in alignment with the goals of the COC, the broader goals that you've outlined here, and just make sure that we're all working together, and there's a concerted effort, a multidisciplinary approach to try to make some progress, both in the short term and in the long term. And I think also that by doing so, and by having an overarching document that is guiding our community's approach, it ensures that any investments that we make as a county or any grant funding that we receive are wisely invested, and hopefully we can produce outcomes and deliverables that point to that.
else, Veronica?
No, thank you.
Okay. Randy?
Yes, thank you for the report. It was great. I have a few questions. We had a presentation from KIT at Social Services on Code Blue and homelessness at the last meeting. Do you guys have a feeling for how many people you think are homeless?
Yeah.
And not including the couch surfers. You don't have to include them.
Yeah. So the data that KIT, I had the opportunity to see that presentation from KIT, and the numbers that were shared by KIT are what I would believe that they're accurate. We're using the same data source for those numbers, so they're pretty accurate. And then in terms of people who are unsheltered living in our community, those numbers are probably somewhere between 50 and 65 people. And historically, they have been centered in the encampment spaces, but I will say that the people are spreading out a little bit more now. So that number, I would suspect there are people in places that we aren't aware of. But I think there's about 60 people outside and somewhere between, depending on the day, 65 and 165 inside in our shelter.
Thanks. On the Rethinking Low Barrier slide, you had SSNs. What is that?
Oh, those are severe service needs.
Okay.
Sorry. That's just from that first slide, which is just a new way of thinking about people we're serving.
That's fine. I like the housing surge idea. I like your process on that. Look forward to see where that goes. I'm also a landlord, so I have issues in understanding of that. One of the things that I've kept an eye on, there are over 20 empty houses in Tompkins County. I think it might be closer to 30 that have emptied for quite some time. And so that's housing to me. It's an asset that for some reason, one reason or another, they're empty. It could be many, many reasons. It could be because the septic system doesn't work or the water system's no good. It could be people passed away. It could be a litany of reasons. So to me, that's housing that could be utilized, especially for entry-level housing people. And the other one is a lot of elderly people live alone. And quite often they live in houses, and they live in big houses, some of them, or it could be mobile home parks. And to me, that's another potential for housing for people to, I realize that people like to live alone, but to pair people up or to even offset expenses for an elderly person who's living alone, as well as maybe could use some assistance. So just some thoughts I had. So.
Yeah, thank you. We want the housing. We want to figure out how to get it. I think it's especially important that housing is set aside for people experiencing homelessness. So there's a lot of often affordable, like quote unquote affordable units that come into the market, but because they're not integrated into our coordinated entry system, they do kind of get lost for people who are experiencing homelessness who need that housing. So I think that figuring out a way for those to become set-asides within our current coordinated entry system would be great, and I would love to collaborate with anyone here who knows how we could do that. Yeah, thank you.
I had a couple of questions. Permanent supportive housing is the real backbone of this plan. Can you define that so that we're all clear what that means?
Absolutely. So permanent supportive housing is housing that is permanent, so someone can stay there as long as they want. It is supportive in that it offers case management, typically integrated with the site, but this idea of integrating like wraparound services without explicitly like requiring them in order for someone to enter that housing. So it does operate under housing first, and it is housing. So it is like physical beds that people can enter. It's not just vouchers, even though that's another type of permanent housing by definition, but permanent supportive housing is essentially what it sounds like. It's also affordable, so the people living there are never paying more than 30% of their income towards their stay.
Examples of existing permanent supportive housing in our system are Amici House, Magnolia House, Chartwell House, Corn Street. If people are familiar with those projects, those are all run by Tompkins Community Action, and then Lakeview has them as well. And others are coming.
Thank you. I know that you're going to be doing the same presentation to a city committee. Can you tell us who that's to and when?
that's going to be to the city working group on encampments. So it's going to be on December 1st.
You. I just wanted to ask our county housing people if you have any comments in terms of whether this plan seems to align with our plans, or any ways that they don't, or any particular ways they do, or anything you want to say. Anything else?
Sure. I think generally we're all supportive. We recognize that we have great housing challenges, especially in the supportive housing realm. And so I do think all of these pieces work together in the continuum. CDBG tends to typically help lower income, primarily homeowners. Our Community Housing Development Fund program is supporting a lot of affordable housing, some of which has supportive services, but not all of it. And so I think we recognize that there are a lot, and the county's housing strategy also speaks to that, the needs for these different types of housing in the community so people can match up with the housing that suits them to succeed in that housing at each stage. So somebody might be transitioning from homeless to supportive housing, and through this surge and through some of the things proposed here. And then as they kind of work their way through, they may be, at a different, after kind of stabilizing their lives a bit and getting some of the support they need, some may transition to other types of affordable housing that these other programs are supporting. And we've seen other people, ultimately become first-time home buyers and things. So I think everybody that works in the kind of the housing world recognizes how all of these pieces connect together. And if any piece is broken, it impacts all the others. So you get, kind of parts of the system where you just can't have somebody throughout their lifespan flow through the housing that helps them succeed in their lives.
Were we involved? Was the planning department involved at all in this report?
Not directly. We want to give full credit to all the people that put the work in, and we're also happy to help. And I think when we talk about where we might have contacts to talk about funding conversations with agencies or things like that, we always welcome working with our partners, including the Human Services Coalition, to help advance that.
Thank you.
And maybe unwittingly had something to do with the plan also, just to be clear, because Elliot and I have had some conversations, and we have been talking about some funding things that are adjacent.
Any other questions or comments from anybody here? Veronica.
I guess Elliot and Megan can correct me if I'm wrong, but I see in our Tompkins County housing policy includes maintaining an adequate supply of housing for people requiring supportive services, which is basically, well, I guess it doesn't have to be permanent, but it maybe should be permanent supportive housing. So that seems quite aligned.
Yeah, and the 2016 housing needs assessment, which I referred to in my presentation, sets targets for permanent supportive housing as well. So yeah, that is part of our program.
Great. Anything else on this topic before we move on? All right, Simone, Cindy, Liddy, thank you. Thanks for your time, much appreciated.
Thank you.
All right, we're going to move on to Office for the Aging. Is it here somewhere?
Hi there, I'm here.
Hey Lisa, how are we doing?
Good, thanks.
Should we just jump right into your resolutions?
Sure. Let's
Okay.
see.
The first one is acceptance of long-term care ombudsman program, American Rescue Plan 2, and long-term care ombudsman program advocacy enhancement, Tompkins County Office for the Aging.
Yes, that's a mouthful. Yeah, so this is just funding that we received, and we want just this funding accepted, and it will be used for providing project assistance to help help enhance our ombudsman program to serve the multiple beds. We have about 1,900 beds residents in 21 facilities that we serve in our region. So this will help us, enhance the program a little bit and get through some of the issues that we encountered during COVID.
Okay, can someone move that one, please? Mike moves, Veronica seconds. Any discussion? I guess I'll just say it's not directly about the vote, but I was just reading a little bit about, I mean, most of our ombudsman services are volunteer, right? There's a paid coordinator and then volunteers that go into the...
Yes. Yes, we have one full-time coordinator and one full-time outreach worker, and the rest of the program is run with volunteers.
I think I was reading something about pressure on New York State to maybe put some money behind paying people to actually do this since it's not getting done in other places.
Yeah, isn't that great?
Sounds right to me.
Let's hope it stays longer than the project assistant, and but right now it's enough to probably fund about 18 months with 2 people, so.
Okay. And I just thought it was funny too, because there aren't too many government services where we rely on volunteers to deliver it. You know, it's a kind of
No, it's a big ask for these volunteers too. They're required to, go into these facilities at least 2 hours a week. It's like a 34-hour training. So it is an extensive volunteer commitment. So, yeah.
Okay, any other discussion? Let's have a vote then. All in favor? Mr. Sigler, you in?
I am in.
Okay. Any opposed? No opposed? That's unanimous. Thank you. Next one up, budget adjustment, Tompkins County Office for the Aging. Is that a resolution? It is. Yes. So, Mike, are you moving that? Thank you. Do we have a second? Veronica, thank you. Lisa, anything you want to say, or should we just go ahead?
Yeah, I didn't hear which one it was. I know I have 2 more.
Oh,
was
yeah.
that the community services for the elderly or
Yeah,
the other one?
I kind of trailed off and didn't finish it. You're right. Community Services for the Elderly program.
Okay, yeah, no, that's just funding that we received from the state to be able to pay our subcontractors the aides, the $2 increases that have been required. So this funding will help us to pay that, and we won't have to take it out of our regular ISEP budget. So we'll continue the same hours for folks.
Any discussion? Okay, all in favor? That's unanimous. Thank you, everybody. The next one up is budget adjustment, Tompkins County Office for the Aging Wellness in Nutrition Program. Somebody want to move that? Randy moves, Veronica seconds. Lisa, anything on this one?
Yeah, this is just more funding that we received, thankfully, and we're handing this right over to FoodNet to help, against some of the rising food costs and expenses that they're encountering right now.
Thank you. Any further discussion? Okay, let's have a vote. All in favor? That is unanimous. Thank you. And then we have the one that was added to the agenda. Budget adjustment, Tompkins County Office for the Aging, American Rescue Plan funding 2022. Somebody want to move that? Veronica moves. Mike seconds. Yes, go ahead, Lisa.
Yeah, this is just a budget adjustment, but we're purchasing some training that's required for our home health aides to continue their certification. They have to have annual training, so this will help us comply with that, and it provides other training for staff, such as caregiver training and things like that. So,
great. Any discussion? Let us have a vote. All in favor? That is unanimous. Thank you. Lisa, is there anything else you want to tell us before we move on?
I really don't have any announcements at this point, but thank you.
Okay, well, thank you. Next up is Youth Services Department. Yes, Kate Shank's booth is here. Hello, Kate.
Hello, how are you?
I'm good. How are you doing?
I'm doing great,
Always enthusiastic. We have one resolution from you. Budget adjustment, Tompkins County Youth Services Department, state aid, final 2022 state aid. Is there anybody that would care to move that? Veronica moves, Randy seconds. Kate, anything you want to tell us about that?
Yeah, so this happens every year. The New York Office of Family and Children's Services notified us of our final 2022 state aid numbers. We got increases in both youth development funding, some additional runaway and homeless youth funds, and then new youth sports education funding that came in. And so this just allows us to make that switch. County state aid is reallocated to the municipalities and programs. So we're going to be in the process of amending our existing contracts and the corresponding accounts. So this is just you letting us move that around.
Very good. $71,000, that's nice, right?
Yeah, yeah.
Okay, discussion. All right, let's have a vote then. All in favor? That is unanimous. Thank you. Next up, well, sorry, Kate, anything you want to tell us before we move on?
No, not at this point.
Yeah, all right. Well, thank you.
Thank you.
Next up is Veteran Services. And we have one resolution. J.R. Claiborne, hello. Welcome.
Here I am. Thank you.
Thank you.
How's everyone today?
I'm doing well.
Great.
All right.
The consensus is we're all doing well.
Yes.
We have one resolution from your department: accept New York State Dwyer Peer-to-Peer Services Grant, Department of Veteran Services. Is there somebody that would care to move that? Veronica moves and Randy seconds. JR, talk to us.
Sure. The short of this, there's a much longer one, but the short of this is that in the New York State budget this year, there was $100,000 given to each county for the development and programming of Joseph Dwyer P. One more time. Joseph Dwyer P. peer-to-peer programming. I'm sorry, I can't talk today. And this is programming that's designed to promote peer-to-peer counseling, and the money is actually pretty wide. The bottom line is that it's money to perform things that are in support of the veteran, and that's pretty wide berth of what that means. And this money was distributed through the office, the county offices for mental health, and in this case, it's being moved towards my department for that programming.
Thank you. Any discussion on our side? All right, let's have a vote then. All in favor? That is unanimous. Thank you. Hey, I'll just mention all the resolutions we've done today are accepting money from somebody else. It's over $250,000 that we just had enter our county today. So, you know, good for us. Good for you that are out there getting this money. JR, is there more you would like to tell us about your department?
Sure, I would. Thank you. I just want to say a big thank you to everyone who has participated in our Veterans Week programs. Yeah, we've had quite a few things happening in the last week, so it's a bit of a blur for me, especially on Friday. But in particular, people have seen around the county, all county facilities have been green lighted. So if you remember when we did the resolution, this is a green light that is put in a public doorway or front-facing window. And this is done to show support for our veterans community because green signifies hope and resilience. And so this helps call attention to that. In addition to our county facilities, the City Hall, or Ithaca City Hall, has also its main entrance green lighted, and the Trumansburg Village Hall has also had the green lights. And if you've had the opportunity to go to or by the airport this month, you'll see that it also has been green lighted. Just pretty neat scene to see. The big highlight of the week was the dedication of our military courtesy room at the airport. And with that, we had the dedication of the room itself, which, even though it's been there for almost 3 years, each time we try to do a dedication ceremony, our COVID numbers spiked. So this time I said, we're going to make this happen. And fortunately, COVID stayed at bay. We've all been healthy enough to be able to have the ceremony. So in doing that, we unveiled officially dedicated the room. But we also featured the unveiling of the plaque that was the Vietnam War Memorial plaque that was given to the county through the Memorial Wall exhibit that was done this summer in Elmira. That was gifted to the county from the VVA Chapter 803 in Elmira to us through the VVA chapter here locally, which is number 377. And that will be installed, the expectation is by the summer. It'll be installed permanently at the airport. We also had the formal presentation and unveiling of the Welcome Home Veterans Kiosk. This is something that was brought to us and installed by personnel from New York State Division of Veteran Services. And the kiosk is basically a 6-foot tall object monitor with screens on both sides, big screens, and they have basically a slideshow of the various benefits for veterans through the different programs in the state. So that was there. That was officially presented by Mr. Benjamin Pomerantz, who is the Deputy Director for Programming for New York State Division of Veteran Services. And he also sang the national anthem and led us in the Pledge of Allegiance. And it's pretty amazing to hear him sing. If you ever had the chance, he gives a very rousing rendition of the national anthem. And I also just want to note on that when he told me later after our program that we are only the second airport in New York State to have this kiosk, the first one being Albany. And that was done through our, just basically when he said it was happening, that was being announced in the governor's budget. I guess I thought I was just asking him from time to time if we were getting it, but he let me know that my advocacy, which is a nice word for him to say, I guess I bugged him to make sure that we were going to have this kiosk. So if you see it, it's in front of the TSA area as you enter into the terminal to go to your flights. So it's pretty cool to see. So just want to say thank you and call attention to that. And the last thing with our program, which also was a personal highlight for me, we had present with us and gave special recognition to our Gold Star families from our current military wars and conflicts. This included one from Ithaca, one from Trumansburg, and who were present, and also the family from Lansing who had their relatives' remains returned last summer from Korea, who was identified during the Korean War. So they came out and they let me know afterwards that this is the first time that they've even been together in one place, and they were appreciative of the moment of recognition. So just a little something to be happy about from our department.
Thank you, JR. Questions or comments for JR? All right, well, thank you.
Thank you, everyone.
Okay, next on the agenda is departmental updates. We have a few departments that didn't have any resolutions, so I'm going to ask each one of them if they would like to talk with us. We do have time. First up is Department of Social Services, Kip Kephart.
Hi. I don't have a whole lot today, Dan, but I will say certainly with the colder temperatures, we are seeing a real increase in our code blue population. And I think this fall it's kind of snuck up on everybody because it was so warm for so long, and all of a sudden it's really turned cold. But we're glad to have that program helping people. And then in a non-service related report, the only other thing I wanted to share is that we had our milestone recognition celebration last week at DSS. We celebrated 27 staff that have all reached various milestones, anywhere from five years of service all the way up to 35. And we had 27 people that were honored. So that was a big crew. Makes me a little bit nervous as I see the number of people that have had significant longevity, because I know that retirement is something that we're always trying to keep at bay. But in terms of celebrating them and having a nice way to honor them, we took that opportunity. So that's all I have at this point.
Well, thank you. Any questions or comments for Kit? All right, Kit, thank you.
Thank you.
Next up, Office of Human Rights, Ken Clark.
Good afternoon. Just one thing from us today. As I've been mentioning, I think in prior meetings, our office, along with the Human Rights Commission, has convened a number of organizations around the county and the city to begin an initiative on civic engagement. We now have come up with a new name for that initiative. It's called Your Voice and Your Vote, the Tompkins Civic Engagement Coalition. We had our launch event on, on Saturday, the second Saturday in November at the Southside Community Center from 12 to 2. We were able to engage with a number of local community members. We served them free Ben & Jerry's ice cream, and a number of our co-sponsoring organizations provided brochures and other information about their specific work, but we also had a chance to talk about what the coalition seeks to do and what it is attempting to do in terms of promoting overall civic engagement. We also talked about how the importance of voting is part of civic engagement as well. We have been meeting every other week since the end of July. And tomorrow we will begin a conversation on structuring the work of the coalition, dividing the labor into and begin a discussion about developing a mission statement and objectives to outline what we would like to accomplish within, say, within 2 years, within 3 to 5 years, and so forth. And so that is something that is beginning to take hold, and there is interest about our initiative that is emerging not only locally, but even regionally in the Southern Tier, in which there are initiatives, a couple of initiatives that we may be involved with in terms of talking about the work or what we aspire to do with the coalition. So that is moving along, and we're pleased with the progress we're making so far. We have a whole lot of work to do, and a lot of work a lot that we would like to accomplish. And so we're in the process of taking steps toward that end.
Thank you. Questions or comments for Ken? All right. Well, thank you. And
you're welcome.
Yeah, we'll see you next time. And we still have Frank Krupa, the County Department of Whole Health.
Hi, everyone. No real updates other than to say happy Thanksgiving.
Questions or comments for Frank? Frank, I wanted to ask you, I don't need a detailed answer, but the opioid task force has been meeting a little bit. Is there anything you can tell us about what's going on with that?
Yeah, we've had our first 2 meetings. We're kind of getting our feet underneath us, trying to find a time where everybody can meet. But we've shared a lot of good data review that's been happening, and we're now working on a framework for potential requests for the funding. So the group is working, and hopefully in a few weeks we'll be making some announcements related to our process for soliciting proposals.
Mike Sigler.
I was just wondering about the COVID data. I mean, we're down to like single digits now. I didn't know if we were going to keep tracking that. So.
Yeah, we're working on that. Actually, I have a meeting Wednesday with staff to talk about how we might shift how we present data around COVID. We're looking at kind of an end of the calendar year as a good point to make a transition there. But yes, there will in the coming weeks be a shift in how and if we report data.
I wanted to go back to the opioid task force for a minute, if I could. So you think that perhaps in a few weeks you will be announcing the funding guidelines?
Yeah, I think that's fair.
And then that would stretch out over a few months or something like that, probably?
Yeah.
So, okay, so sometime early to mid next year, maybe that money will be rolling out?
Yeah, I think that's reasonable. Yep.
And do you know at this moment or at this time the actual dollar amount we're dealing with, or is that still hard to determine?
No, I think we have a good idea. It's about $700,000 that is this first allocation. What's a little less clear is the future allocations, but it's about $700,000.
It's amazing. I was keeping track. I was watching it go up, and it was like 70, and then it was 200 and 220. All of a sudden, it jumped to 700,000. That's a good number. So you're saying it's $700,000 this first time, but we really don't have a good sense yet of what the annual or the ongoing?
Yeah, that's a little bit less clear on what future years are going to bring, because some of the settlements have futures, some don't. And we really rely on the state attorney general to tell us what we're getting. So until they update that, it's a little bit harder to know for sure.
Very good. Any other questions or comments for Frank? All right, well, thank you. That is all I have written down. Did I miss anybody or anything? Okay, any other business before this committee today? Minutes approval, thank you. All right, we have the minutes of October 17th, 2022. Would somebody move those, please? Veronica moves. Is there a second? Randy seconds, thank you. Discussion about the minutes? They're terrific, Mike Sigler says. Please put that in the minutes. Anything else? Okay, let's have a vote on the minutes then. All in favor? That is unanimous. Okay, now I can ask the question. Any more business? In that case, thank you, everybody. Thanks for all the reports and commentary and resolutions and money flowing in and administrative support and legislator interaction. And Veronica has one more thought.
Someone just told me it was Dr. Clark's birthday, so happy birthday, Dr. Clark.
All right. Happy birthday. All right. You're muted, but you're smiling, so we think that's good.
Thank you very much.
All right. In that case, the meeting is adjourned. Thank you, everybody.